In the first segment, we took a 10,000-foot look at the ICSUS Indiana College Substance Use Survey, what it measures, the methodology, and how it is administered. Hopefully, if you don't already participate in the ICSUS, now you see how simple it is and how valuable the information can be and will join us for the next one. In this segment, we're going to take a deeper dive into the ICSUS data from our most recent survey. Here are some highlights. A total of 8,059 students, 18 to 25 years of age, from 23 Indiana colleges participated in the 2021 ICSUS. 56% of all students participating reported drinking in the past month. 40% of students under 21 participating reported drinking in the past month. 1 out of 5 students participating reported vaping the past month. 8% of students participating reported smoking cigarettes in the past month. 3% of students participating reported using opioids without a prescription. 27% of students participating reported binge drinking in the past 2 weeks. What's binge drinking? 5 or more drinks in 2 hours or less for a female, and 4 or more drinks in 2 hours or less for a male. 20% of students under 21 who participated reported binge drinking in the past 2 weeks. How are they getting it? Underage access to alcohol. Half of the students under 21 years of age who have used alcohol reported that they obtained it from friends over 21 years old. 1/4 of students under 21 reported getting it from parents. 1 in 5 students under 21 reported obtaining it at off-campus parties. 10% of the students under 21 who have used alcohol reported having purchased it directly from a retailer. 6 out of 10 bought alcohol without being asked for ID. 5 out of 10 reported buying alcohol with a fake ID. And what are the perceptions of what their peers think? Less than 1/4 of the underage students, 21%, think that it is likely for someone under 21 to be ticketed if drinking at off-campus housing. Less than 1/2 of the students thought their close friends would disapprove if they had 5 or more alcoholic drinks in one sitting or used marijuana. Where are they drinking? Of the students 21 years of age or older who have consumed alcohol, 2/3, 66.5%, drank alcohol at off campus houses or apartments in the past year. More than half, 56.7%, reported drinking alcohol sometimes, often, or always at bars or restaurants. Less than 1 in 9 reported drinking sometimes or more frequently at the other locations investigated on the survey. 47% of all underage students reported drinking at off campus houses or apartments, followed by residence halls, where 16.6% of the underage students who have consumed alcohol reported drinking sometimes, often, or always in the past year. What are they drinking? 58% of students who drink say that they drink liquor sometimes, often, or always. 54% of students who drink say they consumed malt liquor sometimes, often, or always. Female students were much more likely to report drinking flavored malt beverages. Male students were more likely to report drinking beer. Students who identified as other than male or female reported a higher rate of drinking high alcohol drinks. Students 21 years of age or older were more likely to report drinking beer and wine sometimes, often, or always. Why are they drinking? 8 out of 10 students reported that they drank to have fun with their friends. 55% reported drinking to relax. Almost 1/3 of students who don't identify as male or female were much more likely to report drinking to get away from their problems. More than 1/3 of the underage students, 38.4%, reported drinking to experiment. 6% of the students who drink said that they do so to make it through the day. 2% of the students who drink said they do so because they're hooked. Consequences. More than half of the students participating who drank alcohol in the past year, 53%, reported having had a hangover. 23% felt bad about their drinking. 21% of the students participating reported blacking out. Blacking out, forgetting where they were or what they did. 15% of the students participating reported engaging in unprotected sexual intercourse. 1 in 9, 11%, reported missing class or an assignment as a result of their drinking. 9% of the students participating reported that they had been hurt or injured in the past year as a result of drinking. More than 1/3 of the students who participated in the survey reported that they had taken care of another student in the past year who had drunk too much alcohol. 25% of students reported that they had acted as a designated driver because of another student's drinking. 24% had their sleep interrupted because of another student's drinking. We also asked questions about student gambling. In 2019, the Indiana legislature approved sports gambling. Other forms of legal gambling in Indiana include pull tabs, number boards, bingo, and charitable gaming. Did you know that college aged men gamble at rates almost 6 times higher than the general public and that they mostly gamble on sports online? Here's what students had to say: 27% of female students reported gambling, 48% of male students reported gambling. The most common form of gambling among students was playing the lottery, followed by card games. Male students in Indiana's survey reported higher rates of gambling for most of the gambling behaviors. Consequences: 8% of students who gambled reported at least one negative consequence because of their gambling. Why is this data important? You can't work on a problem if you don't know you have a problem. Our data tells a story that is powerful and necessary to influence people and policy and make change possible. As someone said, data is not about adding more to your plate. Data is about making sure you have the right things on your plate. When you think about all the ways you use data on campus, you will quickly see why having accurate and accessible data is so important. You can use data to increase diversity in student enrollment, identify at risk students, track attendance, track and increase graduation rates, evaluate curriculum, identify key donors, and meet student health and mental health needs. The ICSUS data and any additional data you collect should be the first thing you consider when making decisions about alcohol and other drug education, programming, and policy. Sharing information in a presentation can be a simple first step to informing campus coalition or task force members of what's happening with students. Taking a deeper dive into the data, examining each section individually, and then creating a plan to address each issue will help you as you write your campus strategic plan or department plan. Data can also be used with student leadership as they create their platform and engage the student body throughout the year. The best thing about ICSUS is that every campus can ask up to 10 questions of their own design. These questions can measure anything and are a great way to get input from others, especially those departments or offices that you don't normally partner with. Maybe you're asking questions about the registration process, the health food options offered, or the green space and design of campus. These might not be directly related to prevention at first glance, but we know that environmental surroundings and how satisfied students are with their campus experience does. Promoting the wellness of students in every capacity has a positive impact on substance use and other high risk behaviors. That was a lot of information, but hopefully you have a better understanding of how Indiana college students are engaging in high risk behaviors because in our next micro training segment, we're going to look at how this data and the data you collect on your campus can be used to inform policy, strategy, and programs. Don't forget to click the link in the video description to answer a short evaluation survey, and we hope you join us for the next segment. Thanks!